Let me start with a simple question for you both. We're heading up to, there'll be a change in administration. It's been an active time. What's the top couple things on your agendas right now, even for all that you've done, as you look forward as to what still needs to be done, or what are the preoccupations on your minds? Do you want to share a couple of things that are top of your to-do list?
My top priority is really the workforce at the FDA, and I think it's really critical to remember that we're both a regulatory agency and a public health agency. Our work is built on science, and increasingly people see it as in our mission to not only provide safety but also stimulate innovation. And in fact, when I was offered the job by the president in the Oval Office, he specifically, after he spent 10 minutes telling me how much he hates Duke basketball — I'm a Duke guy, he's a UNC guy — his discussion with me was about regulating and keeping people safe, but also realizing that innovation is what makes America a winner. And it's in our mission statement to do that. So we need top-rated people at FDA, the best scientists, the best lawyers, the best policy makers. And we're a little bit like a startup. We've doubled in size essentially since 2007 because the industries we regulate are either thriving, like the one today, or the medical products industry, or there's an industry like tobacco that was added to our remit in 2008. So I'm spending a lot of time on the workforce. The second big one, and very much fits in with what Frank was just discussing, we're very dependent on good data. When we make decisions based on lousy data, it is not a pretty sight, and that happens all too often. When we make decisions based on really good data, people still disagree because you can interpret things differently, but it's a very different situation. So we need to build our data sources inside the FDA and the way we relate to the ecosystems, and there are many ecosystems that we're involved with. Those are my top two priorities.
Susan, I know we were talking about one of yours backstage, which is the education part, the nutrition part, and there's a couple of threads there. I know that the FDA is looking at what the definition of healthy is and rethinking healthy, and you're looking at, I think, natural. Natural is another term you're considering. So talk a little bit about what needs to be done on the education front, and I guess I sort of have this feeling that we've talked a lot here today about consumers and their concerns and companies responding to them, and yet there's still an awful lot of confusion or conflicting information out there. So what needs to be done to make that really better?
Yeah, I think we really need to work on that. And we are a science-based regulatory agency, and we have a big public health mission. And food does a lot of things to us. We celebrate events. It's part of our culture. It's also really important for our health. And we haven't talked today about some really essential things from my perspective that FDA cares about. So for example, we're concerned about things in our food supply like too much sodium, and how do we help promote health by working with industry to make a healthier food supply. We also believe that there are other things in the food supply that we can do better on. One of those was artificially produced trans fats. FDA was concerned about that. That's an important contributor to cardiovascular disease. So we've been working on these big public health issues for some time. And what I often see is people focus in on the foodborne illness, the infectious, the contamination side of things. That's mostly what we've heard here today. But don't think about the chronic diseases. And remember, in our country today, the top killers are heart disease, cancer, diabetes, diet-related chronic disease. And I want to be sure that people are realizing that healthy eating is a tool to reduce the rates of these really prevalent chronic diseases. And as Frank Yana said, I agree, salad, we recommend more fruits and vegetables. So I want consumers to be confident in the safety of produce and fruits and vegetables, and that's one of the things we're working on. If Americans consume more produce, we would have a healthier population. And so those are the things I think about, is that intersection of food safety, nutrition, and getting those really important messages out to consumers about the importance of calories and sodium and things like that.